Hi everyone, it's Aubrey Jabour with Northbound Physical Therapy and Wellness. And today I'm here with some tips for you on dealing with lower back pain. If you haven't already seen, I have a blog post about how to navigate low back pain when it occurs. It does occur for most people at some point in their life. So have some strategies for you to look into that can help um, when back pain does occur. And included in that was listed a few exercises that we're going to perform today. And so these are very gentle movements you can try, whether your back is experiencing acute pain, so new onset pain from something like a muscle strain, um, or whether you just have a stiff back and maybe there's some discomfort that's been there. That's kind of the realm that these three movements we're going to discuss will help. So think of these as a great starting place that you can do with relative certainty that they'll be comfortable and very gentle for you, and you can implement that sort of stoplight analogy of green, continuing to move within these movements. The green light is it feels good. Your comfort improves as you do it during and after. Yellow light is there might be some sensations of discomfort or sensations where you're not really sure if that's good or bad in that time, but you can kind of make that judgment as you continue along. You can kind of proceed with caution and then judge how you feel afterward. And then a red light would be something that's really increasing your pain. So just like every time we go through movement pattern, I just ask that you honor your body and what you need, whether that's performing these movements, not performing them, or seeking medical care. So let us proceed now with our three gentle movements for a painful or a stiff lower back. This is a great starting place. I am on the floor, but if it's uncomfortable to get down on the floor, do this in your bed or on another surface that's accessible. And we just know that depending on how soft your surface is, it might kind of change the way that this feels. So the first thing I'm going to do is some diaphragmatic breathing, which just means deep, slow breathing. And the point of this is to start to come into your body and be aware of what you're feeling. You could actually do this one in sitting. Lying down is a nice position because your spine is a little more unweighted. If I was in really uncomfortable pain, I'd put my feet up on a chair on the edge of a couch or a ball or a stack of pillows into this 90-90 position because that can further sort of offload the weight of the legs on the spine. It can just feel really nice and allow your back muscles to relax. So the first movement is really just movement from the diaphragm. So I like to put a hand, maybe one on chest, one on belly, or both on belly. Take a nice deep breath in through your nose. And as you breathe in, you can feel the belly start to expand. And then relax as you exhale. So let's just take a few breaths together. And if a person is in discomfort or they feel stiff, this is a good time to just be aware of your body and start to notice, am I gripping? Am I hanging on tight to any muscles? And can I let those go in this very safe position? Our brain will often try to protect us. Our body's always going to try to protect us from pain. So muscles guarding can be one factor that contributes to that tight sensation or kind of perpetuate our cycle of pain. So being here in a safe posture, going through some breathing. And on the exhales, just seeing if you can allow any areas of tension relax, whether that's in your back, your hips, neck and shoulders, jaw. Just try to let go. Good. And so the way that you would use this as a tool for yourself could be to, as a starting place, if you're just getting your movement going, or if you're feeling kind of just really ramped up in your pain and you need some time to settle. The other nice thing about breathing is that breathing slowly and deeply naturally stimulates our parasympathetic response, which is sort of that relax, rest, digest, and it can have a calming effect on our body. Okay, so that was movement number 1. Movement number 2 is a pelvic tilt. And if you've ever done yoga, you'll be familiar with this pelvic tilt. It may be hard to distinguish because I'm wearing dark and I'm on a dark mat, but I am keeping my body against I'm keeping my butt against the floor, but I'm arching and tucking my pelvis back and forth. This is a very common movement. And the point of this is just to gently get the spine moving. As you arch your back, you feel it gently lift away from the floor. And as you round it, you'll feel it sort of press flat into the floor. The whole point of this is to really just move in an amount that feels good to you. If you're dealing with a strain or with stiffness, you might not feel like you move very much at all at the start, but over time, you might feel that you limber up a little bit. So pelvic tilt, that's number 2. If you're a yogi, that mimics this sort of cat-cow. So we call that cow pose and then cat pose. You could do these movements as another alternative to the pelvic tilt on your back. I personally would probably pick cat-cow, depending on if I could tolerate it. And as far as how much to do, start with 4 or 5 repetitions and then see how it feels. Maybe do up to 10 or 20 and see if you further appreciate the sensation of improved motion, reduced discomfort, reduced muscle guarding. But pick the amount that feels right to you. You know you've done enough, so to speak, if you experience a positive shift in your symptoms. So you probably don't need to do 1,000,000 or 1,000 of these, but 10, 20, 30, if you compare how you felt before you did them to after, do you notice a positive shift in how you feel? That's really what you're looking for, and you're looking to make that connection for yourself of, I do this movement and I get this result. And this is about how much I need to do to appreciate those benefits. So I tend to not focus very much on reps because I want a person to focus on what they feel in their body. Okay, third and final movement. We could call it windshield wiper. We could call it lumbar rotation. But this one is dropping both knees together now, side to side. This is probably one of my favorites for my own back. Think of this as a massage, a gentle stretch. You don't have to go as fast or as slow as I'm going. Find something that feels right to you. And if it feels good to drop both knees and hold it, please do. This is a great place to also add in some breathing. And you can sort of go through that routine of allowing your muscles to relax on your exhale and just trying to let go of anything that's guarding or hanging on tight for you. And as far as how many to do, the same philosophy applies here. Start with 5 or 10, see how you feel, do a few more, and then see if you notice a positive shift in your symptoms. If you do notice a positive shift in your symptoms with any of these, you can start to incorporate these throughout your day, especially if you are stationary during your day at work and you do have back pain or a recent muscle strain. You want to keep moving within reason, and that is also included in the blog post. It talks about how continuing motion is an important way for reducing or mitigating low back pain, and it's also a big part of preventing low back pain. All right, I will wrap up this video. Thank you so much for checking out these movements. Let me know if you have any other areas of focus you'd like me to discuss on these videos, and I look forward to seeing you next time. Thanks.